Okay, so first I would do hand hygiene and ensure patient privacy. Hi, I'm Akai. I'm going to be your nurse today. This is going to be a quick head to toe assessment. It should take about 15 minutes. Do you have any questions? Are you in any pain?
No.
Can I get a first name and a last name?
Wazil Sankari.
Your date of birth?
May 5th, 2004.
Okay. Do you have any shortness of breath?
No.
Any coughing?
No.
Okay. If you do get short of breath at any time, just let me know. If you do have any pain, just let me know. Okay, so first we're going to start off with, again, who are you?
Wazil Sankari.
Okay, do you know where you are?
Yes, my room.
Okay, do you know the date?
March 16th, 2026.
Okay, and do you know what holiday just passed?
St. Patrick's Day.
The patient is ANO times 4. Okay, I'm going to look into your eyes. Okay, with room light first. Okay. Okay, so in regular light, the patient's eyes are about 4 millimeters bilaterally, and with direct light, they constricted to about 3 millimeters. All right, so now I'm going to assess your skin. Okay. The patient's skin is warm. He appears to be pretty healthy for the most part. His skin is intact. The skin is evenly distributed by color on both sides. Okay, now I'm going to have you grab on or hold your arms like this. Okay, now squeeze. Okay, strong on both sides, +2 on both sides. I'm going to have you do your wrist like this. Pulses are +2 and strong on both sides. Okay, now I'm going to now I'm going to go ahead and listen to the patient's heart. I'm going to start by listening to the aortic, 2 intercostal spaces down, the pulmonic, 2 intercostal spaces down. I'm then going to go down 1 intercostal space to Erb's point, then to the tricuspid, and then 5th intercostal space midclavicular underneath the nipple. I'm going to listen to the apical pulse or the mitral pulse. I'm then going to listen with both my bell and my diaphragm. Okay, S2 and S1 and S2 could be heard on with both the diaphragm and the bell. There were no adventitious sounds such as a murmur. Yeah. Now I'm going to listen to his lung sounds. I'm going to first listen anteriorly, then I'm going to listen posteriorly, and then I'll listen to the lateral sides. If you do feel shortness of breath or dizzy, just please let me know. When you feel me, or I will just tell you when to go breathing in and out, or when to breathe in and out. Okay? Go ahead. Go ahead. Okay, now I'm gonna listen anteriorly. One more time. Okay, the patient has clear and equal breath sounds anteriorly, posteriorly, and laterally, bilaterally throughout with no adventitious sounds. He has an intercostal space, keep these sit straight up. He has an intercostal space of about 90 degrees. His trachea is midline. His back and spine is straight. So now I'm gonna ask the patient to please lay down flat on the bed, going this way. You're then gonna keep your knees raised like this. Okay, observing his abdomen is flat, his umbilicus is inverted in. The color throughout his abdomen is appropriate for his ethnicity. His skin is warm and dry to the touch. Okay, so if you experience any pain, just let me know. First, I'm going to listen to his bowel sounds in all 4 quadrants, starting from the lower right, then moving across down to the lower left. Okay, if you start to experience any pain, just let me know. Okay. Bowel sounds could be heard in all 4 quadrants. His abdomen is soft with no pain, no rebound tenderness. Okay, with your bowel movements, have you had any diarrhea, constipation? Let's see, any vomiting? Okay, when you urinate, does it burn? Do you have any urge to urinate? No. What is the color of your urine? Okay. Does it have any smell? Okay. So those are the genital urinary questions. Okay, so now I'm going to feel the pulses in his feet. Dorsal pulses are about +2. I'm now going to check for cap refill on both sides with fingers. Go like this, please. Cap refill is immediate. And now check the cap refill on the toes. Cap refills on toes are immediate, less than 2 seconds. Now I'm going to ask you to please come straight out like that. Now I want you to push on my hands like a gas pedal. Okay? Now go against me. Okay. Now I want you to raise them up, go against. Okay. So strength on both sides is normal. Strength is strong. Let's see here. Let's see if there's anything else. Skin is warm to the touch. Pulses. He is appropriately dressed. He talks appropriate for his age. Yes, and that concludes my head to toe.